and also got an opportunity to work in the COVID clinic. Got a chance to kind of volunteer there as well. So just to kind of give you some information about the vaccine, I know we're doing the Pfizer vaccine there today, and that's an mRNA vaccine. It's about 95% efficacy, which means that when you get this vaccine, it's about 95% chance to decrease the severity. It'll decrease the chance of having any type of severe disease. It'll decrease the chance of hospitalizations, and it'll decrease the chance of death, which is actually really good. It does mean that, there's still a possibility that you could still, come in contact with somebody who has COVID, but it'll make it very much more like a cold. And it'll be a lot more protective by having this vaccine than not having it. You would require to have 2 different vaccines, about 4 weeks apart, 28 days, but you are not going to have that vaccine kind of protection until 14 days after the 2nd dose. And so sometimes people might try to get 1 dose. You won't have that protection after 1 dose. You probably would get about 40–50% kind of protection. After the 2nd dose, even after you get that 2nd dose, you won't have that 95% effectiveness. You really have to wait that 14 days and actually to be protected. I've heard some people say, oh, I got 2 doses, and I know people who got 2 doses and then they still got COVID. And a lot of times they got the COVID back, they got COVID and they kind of went out and they didn't wear the mask. It was within that 14-day period where their immunity hadn't gotten built up. I've also heard people say, if I get the COVID vaccine, they're putting the actual, virus inside of me, and that's not true either. So the way the mRNA vaccine works is they take something that we call a spike protein, which is kind of like if you think of COVID being this big monster, they take like this little bitty spike, they put it in kind of like we call a vessel or maybe like a little spaceship. That's what's actually injected. Your body recognizes it, says, if I see anything that looks like this that comes near me, attack it right away. And so your body builds these soldiers. They build these soldiers, and these soldiers, they kind of stay in your body, and as soon as they see anything that looks like it, it's able to attack it right away, and that prevents that COVID virus from doing any type of damage. And one of the things that we saw is that when this COVID virus gets into your system, that over that first week or 2 is that it will just ravage the body before you even know it. It just destroys the cells. And so by having this vaccine in your body, what it does is before the virus has the opportunity to destroy the cells, your body will actually have these soldiers built. And so as soon as that virus enters the body, then the vaccine will be there, and then these soldiers will be able to just automatically go and destroy the virus before it can do any type of damage. Some people will say, well, what's the difference if I get this vaccine and I can still get COVID? What's the point of getting it? I can tell you the biggest thing that we can say by getting this is that you decrease the chance of having what we call becoming a long hauler. So people who got COVID and didn't have the virus or didn't have the vaccine, we're seeing them now come back, and now they have a stroke. Now they're coming back and they have heart attacks. They're coming back and they're having memory problems. We're calling these guys long haulers, meaning that they had the virus back in the spring, or they had it back in 2020, and now they're coming back with long-term effects. So now the vaccine will prevent you from having that because you won't have that damage done. So these are some of the benefits from having the vaccine done. And so I'm going to stop talking because I know you guys probably have questions, but that's, having a vaccine is going to be 95% efficacy. It's effective against this new strand, the Delta that we're hearing about. It's really good to have it, and I'll open it up for any questions that people might have.
Yes. All right, so my question is, how long does the protection of the vaccine last, and will we need to get booster shots?
Yeah, so right now that's what they're looking into. The research was showing that it could last, 4 to 6 months. Even with the 4 to 6 months, the research that's coming out now saying that it's still 90% effective. So in the clinical trials, they found that it was about 94–95% effective. In the real life trial, so when they're seeing all these people, they saw that maybe about 90% And so the clinical trials are saying that it might be losing some of the effectiveness about between month 4 and 6. The trials are differing, and that we might need a booster shot. But even if it drops, it's still at that 90% rate. So you're still not going to be hospitalized. You're still not going to be, you know, dying from it, but it might not be as effective as it was when you first got it.
Also, what risk versus the benefits are there for women who are pregnant to get vaccinated?
Yeah, so they have not found any. They have not found any adverse effects from people actually getting the vaccine in pregnant women. They've actually shown that some of the women who actually got the vaccine while they were pregnant were able to give antibodies to the baby. So the babies were actually born with some of the antibodies. So they found lots of benefits. They have not found anybody that's had any loss, any fetal loss, any miscarriages, any infertility. The only reason that people were saying that the pregnant women couldn't have it in the past is just because they were not in those original trials. That was the only reason in the beginning that that was an issue. But now many, many, many pregnant women have gotten it, and there has been no adverse effects. So they haven't found any risk at this time from, you know, healthy women that are pregnant from getting the vaccine. So there's been no contraindications or no reasons why they say pregnant women shouldn't get it. They actually encourage women pregnant and not pregnant to get it.
We have another question.
How different is the Delta variant than the original strain?
How different?
I couldn't hear that question.
How different is the Delta variant from the original strand?
And what precautions should vaccinated people take?
And what precautions do vaccinated people take?
Yeah. So this Delta variant is very different from the original strand. One of the things is that the vaccine was created, of course, to protect us against this alpha strand, right? That's what we're all protected against. The original strand that came back in, you know, December, January of 2020. This Delta strand has been found to be much more virulent, which means it's much more contagious. Think about like chickenpox, common cold. Some people are saying, some studies are showing that it can spread if you're within reach of somebody within 15, 20 seconds, that you can get it. Like they're saying it's that virulent. Whereas before you had to be in a room for like 15 minutes or something like that with the alpha strand. It is much, much more contagious. The other thing about this Delta strand is vaccinated and unvaccinated people can get it, and they can spread it, but vaccinated people might be asymptomatic, which means they might not have any symptoms. But if they come around somebody who is not vaccinated, they would be able to pass it along to that person who does not have a vaccine, and that person can get really sick. And we're also finding that the people who get the Delta variant can become very sick if they do not have a vaccine. So this Delta variant, I don't know if you've been following the news of things that's been happening in like India and things of that nature. It's a completely different beast because it's mutated, meaning that the medicines and things that we've had, it's been able to mutate in order to kind of become a little bit more resistant. It's able to be stronger than some of the other variants that we've seen, and it's able to spread faster, and it's much more robust, and that's what makes it kind of scary. They're saying it's COVID, and it's the COVID vaccine of the unvaccinated, because the people who don't have the vaccine are the ones that are really kind of spreading this fourth wave that we're seeing now.
Dr. Gordon, I have a question that I hear, which we heard several times, with that age group that falls between that 18 to 30 group who don't have any previous medical conditions. Why would they want to get this vaccine? They don't have any previous.
Can you repeat that question? You said something about the age group.
It said for people who are between the ages of 18 and 30 who have no pre-existing conditions and are healthy, what's kind of the messaging to them when they say, why should I get the vaccine? I'm relatively young and healthy.
Yeah. So that is the biggest misconception, and I try my best to talk to that age group in particular. when I was just covering the hospital, I had 21-year-olds. I had so many young people that came in there who had that same kind of thought process, and we lost some of those same people who they all thought that, you know, they just thought that they were invincible. But COVID does not look, it's impartial, right? It doesn't look at your age. It doesn't care if you're healthy. It doesn't care if you're young. And it's so funny because we could have a 94-year-old that you just wouldn't think would make it, and that person was leaving the hospital, and you could have a 21-year-old that you had to call their family for and say, you know, I don't think this person's going to make it. It just did not. You just couldn't. You couldn't tell who was going to make it and who wasn't. And so, yes, we do have this idea that if you're really young, the likelihood that you could, you know, kind of make it through this and live, and your body can kind of bounce back. And that can definitely be true. But then even if that's the case, we still find out that these people come back and now they have heart failure. And it's like, you're 30, why are you coming in when your heart is now at a, you know, functioning at a 40%? Why are you coming back and now you're having memory problems? Now you're coming back and you can't breathe and now you're on 2 liters of oxygen. So this young population between 18 and 30 who think that they're invincible, that's the same people that we're seeing coming in with these new health problems because they didn't recognize that COVID doesn't care how old you are, and it doesn't care that you don't have medical problems. It will destroy your lungs, it will destroy your body, it will destroy your heart. And that's the messaging that we've been trying to get across, but I think unless people actually see somebody go through it, or they actually go through it themselves, you know, we just got to continue to try to convince them. And I think that's very difficult. I don't work with a lot of younger, you know, I don't work with kids, but I definitely been trying to have that messaging towards that younger population who definitely have that kind of attitude.
Another question that came in was, I've had COVID already, why do I need to go get the vaccine if I have antibodies?
Right, because you have antibodies against the variant that you got. So we see people coming back, and so you got antibodies against the alpha variant. It doesn't mean that you can't get the delta variant, right? And so once again, these variants they mutate. Just think about the flu. I had the flu. Can you get the flu again? Yes, because there's influenza A, there's influenza B. And so if you have the COVID before, you had that one variant, and you only have antibodies against that variant. And once again, the antibodies that you have will wean. And so you need to get, you know, the vaccine to protect you against any of the other variants. And you also need to get the vaccine just to make sure, well, pretty much just to make sure that you're protected against the other variants.
Dr. Love, what do you say to people who said this seems like a rush, the vaccines were rushed, being processed, you know, it's in a, usually when we hear about vaccines being processed, it takes years and years and years, and this seems like it's just, you know, just thrown together. What do we say to people under that?
Yeah, so that's a really interesting one, because if you actually take a step back and look, the mRNA vaccine has actually been in process of being made for decades. They started to make the mRNA back in like the 70s or the 80s. It was actually, you know, by a female physician or female scientist who nobody would actually pay attention to. And she kind of went through different phases and then different companies. And it wasn't until this came out that people actually hung on to her research. But if you take a look at the history of mRNA, it actually has been there for decades and decades. And she was trying to get people to see that we could actually cure things like cancers and things if we could try to take a piece of it and put it into people's, you know, bodies and get it to replicate. We could actually fix things. So this mRNA technology has been around for a long, long, long time. They were trying to work with it for the influenza and things like that. It just so happens that COVID came and the company was like, let's take this mRNA vaccine and let's see if it'll work for this. And that's why they were able to use it so fast. So I know to the general public, it seems like that was really, really fast. However, the technology has been in the makings for decades. We just weren't hip to it because we weren't really we never had a pandemic before, and nobody really pays attention to science and, you know, the articles and things like that. But if you actually go back, this mRNA technology has been around for a long time, and it's just amazing that it works. And actually, the reason that we have Moderna and Pfizer is because she used to work with one company, and then she left that company and went to the other company. So she used to work with Fauci, which is Moderna, and then she left Fauci's company and went and worked with biotech, which is Pfizer. And that's why both of these companies are able to produce this mRNA, because she was the one who worked at both of these companies, and they have her technology. And that's why those are the only two companies that have mRNA, and then everybody else has adenovirus and things like that. So if you go back into the history, you will see that this technology has been around for a while. It was by a female scientist who actually started to create it, and it's fascinating. But once again, if you're not into the history of it and you're not really into science, because it's more like research and PhD kind of stuff, you would think it's fast, but it really wasn't. It's been decades in the making. And I try to tell people that, but nobody wants to kind of hear that part of it. But it's not new.
She's a black female. Also, is that one that?
I'm sorry?
No, she was asking if the scientist was a black female.
There was one that was a black female.
The black female works with Fauci, but she's not the one who actually came up with the mRNA technology. I think she's like from like Eastern European, the woman who came up with the technology. She's Eastern European.
Another question that we get is, if everyone in my household is vaccinated, why do I need to be vaccinated? My parents are, et cetera, et cetera.
Because once again, even if you're vaccinated, I have two little kids who are not vaccinated. Me and my husband both are vaccinated, and we still wear masks because I work in environments where I come in contact with COVID patients all the time. Therefore, I can still get COVID, right? I can still bring it home to my kids, and I might not even know it. I got tested twice this week because I can still get it and may not know it. And so it's really important for us to still make sure everybody in the house is vaccinated, because even if you're vaccinated, you can still get it, you can have no symptoms, and you can bring it home to somebody who does not have the vaccine, and then they can get really, really, really sick. And so that's something to remember. So you want to make sure that everybody is vaccinated in the household, and if you're not vaccinated, you want to make sure that you get vaccinated, because you can get sick from them, and then you can also get them sick and they can take it to someone else, thinking that they're protected because they wouldn't know if they don't have any symptoms. So it's important for everybody to either wear a mask or at least get vaccinated.
So what does it mean that the vaccine is for emergency use authorization?
Right. So typically, in order to have full FDA approval, it has to go through multiple steps, and it can take up to, a year or 2 years. And emergency use authorization means that they went through this process a lot faster than normal, and so that's why it's under emergency use. Hopefully by the end of the year, it'll have full authorization and it'll be full approval, and then it wouldn't be under emergency use. So it's under that name so that they could put it out faster than what they normally would. That's why we were all able to get it within, weeks to months, as opposed to waiting like a year or two. If that makes sense.
In the likely event that the virus mutates once again, is there a pretty good chance that we will be required to get a third shot?
Can you repeat that one more time?
I will. The question was, in the likely event that the virus mutates a third time, will people likely be required to get a third shot or that booster shot that you?
I think in the future we're all going to have to get a booster shot. I think that's what we're moving towards, honestly. When they're going to ask us to get it, I'm not sure. Will it be a year down the line? I'm not sure, but I do think that we're going to have to get a booster shot. And it might be that we have to get it once a year. I know when they first came out, they were saying, oh, maybe once every 5 years, but it looks like it might be maybe once a year, might be sooner than later. They haven't said for sure, but they are doing these studies, and with these different variants, especially now with Delta, it looks like it might be sooner than later. So yes, I do think we will need a booster, but when, I don't know.
Oh, yes.
Okay. What would you say to people who believe the vaccines are not safe?
What do you say to people who believe the vaccines are not safe?
Are not safe. I guess I would first try to see why do they believe that it's not safe. What is the reasoning that they think it's not safe? I think everybody has different reasoning. Some people think it's because of their own personal, health conditions that they think it's not safe, or some people think it's not safe because of the, whatever's in it. So I would try to gauge why they think it's not safe and then try to kind of go at that angle. Is there a particular thing that you think is not safe? Like, is it an ingredient that's in it, or do you think it's not safe because of a specific condition or medical condition that you have? I know some people that I talk to, they say, oh, it's not safe for me because I have I'm immunocompromised, or I have an allergy, so it's not safe for me. And then I've had other people say it's not safe because it came out too fast, or, I don't know what's in it. So just depending on what people think, then I kind of address it at that angle. But I can tell you, for the most part, it is safe, and it definitely is much more, the benefits of getting this vaccine is much more safer than actually getting COVID itself.
Dr. Webb, do you have any recommendations for people who are vaccinated, how often they should be tested for COVID-19, since now that the Delta variant is going around, even vaccinated people are more apt to get COVID-19? Is there a recommendation as to how often you should be tested?
Yeah, so once you're vaccinated, you don't necessarily have to get tested unless you come in contact with somebody who actually had COVID, or if you start to have symptoms that are, that you think might be because of COVID. So if you start to have coughing, fevers, if you start to have, diarrhea, GI symptoms, nausea, vomiting, you're not feeling very well, sore throats and things of that nature, you start to get short of breath, then at those times you can say, oh, let me get tested. Even if you're vaccinated, you can get tested and see if that's because of COVID. Sometimes people think, oh, this is just my allergies. You don't know how many times I've heard that. This is just my allergies. They get tested and it comes back and it's COVID. And they think that's not COVID because they got the vaccine. So in those particular instances, I would say if you're experiencing some symptoms, get tested. If you came in contact with somebody, get tested. Now, for me, because I work in a hospital setting and I work with patients who have COVID and things like that, I get tested fairly regularly because I have little kids. And my parents are immunocompromised. And then the other thing is if you travel. So if you're traveling and you're going on a plane, or if you're traveling someplace else, they will make you get tested. So a lot of times the embassies will say you got to send in a COVID test, a negative test, 72 hours before you go. And so they request those tests and things like that. I think now that the Delta thing is going up, either you're going to have to produce a negative test or you're going to have to produce your vaccine card. So if you can't find your vaccine card, you're going to have to get tested in that aspect too. So those are times where I think you'll have to get tested. Otherwise, you don't have to get tested. I would say even if you're vaccinated, you still need to wear your mask. That's the one thing I can say. Even if you're vaccinated, I still wear my mask when I go into grocery stores, restaurants. Anytime I'm around people that are not my immediate family, I still wear a mask. Outdoors and stuff, I know people are saying they don't have to wear masks, but I still wear a mask all the time. So vaccinated or not vaccinated, I would say the mask is still the best way to go.
There was a question, someone said, referencing they're on chemo. Is the vaccine something that they should still get?
So immunocompromised conditions, we do say that you need to talk to your doctor first before you get it, because I do know that if you are taking things like prednisone, if you're taking prednisone, sometimes we have to adjust your medication dose before you get your vaccine. Sometimes you have to double or even triple those doses based off of your doctor, because the vaccine can actually cause a flare of that cortisol. So if you are taking certain medications or chemo and things like that, yes, you can still get the vaccine, but you need to talk to your doctor to see if you need to make adjustments to your medications before you get the vaccine. So immunocompromised conditions, talk to your doctor before you get the vaccine to see if you have to make adjustments to things.
think all the questions we have in the chat.
Any other questions, anybody?
Dr. Gordon, I know you talked about like people traveling, and 72 hours they sometimes generally have to present a negative COVID test. Like now we're having this big concert here. Is 72 hours sufficient of time for them to get on a test? Shouldn't they test wait a couple days? Because sometimes the symptoms does not even show up within that 72-hour time frame. So I can get a negative test in 72 hours, but all along, which would seem a week later, a person actually they're negative that day, but then come back 2 days later and positive.
Yeah, that's a whole nother. That's a whole nother thing. I saw the pictures of that at that concert. OMG! I just wonder what our numbers are going to be in a week or two. So you're right. You're right, because number one, if you get tested, this is the misconception. The testing, depending on what type of test you get, if it's a rapid test versus a PCR test, the tests are only going to tell you whether or not you're positive. If you're negative, those tests are only about 50 to 75% accurate. So that means there's still a 50 to 25 to 50% chance that you're still positive even if you get a negative test. That's why I got tested twice this week, because even if you're negative, you could still be positive. And a lot of times, just think about it like a pregnancy test. If you get a pregnancy test done too early, it's going to come back negative, because if I get a pregnancy test the day after conception, it's not going to come back because I don't have enough of the what we call HCG in order to make that test positive, right? So if I go get a test the day after conception, it's not going to come back positive. I got to wait like a week or two in order for it to come back positive. The same thing, you need a certain amount of virus in your system in order for that test to come back positive. So if I'm not expressing, just like you said, if I'm not expressing enough symptoms, or if I'm not expressing symptoms, I might not have enough virus in my system to make that test come back positive. Whereas in a week or two, I might be coughing, I might have fevers. Now my test don't come back positive. So just like you said, if I get a test today, it could be negative, and then in 3 or 4 days, it's going to be positive. And so I can present a negative test to that, go to that concert, but then a week later, it's going to come back. So, yeah, you're right. It's
So just go ahead and quarantine now.
Right. That incubation period, that was the whole reason that we quarantined people in the beginning for, 7 to 14 days, because it took that much time in order to express a symptom. And that's the whole point of why we say masks are so important. And it would have been better to see people wearing masks at the concert, because at least then people couldn't spread it. But I didn't see one mask. Anyway.
Could you speak to the difference between the period of when people are most contagious versus the incubation period? Like, what are the differences? When are people most contagious versus starting showing symptoms?
Yeah, actually, people are contagious. People are more contagious in that phase where you really can't tell that they are symptomatic, and all the way up until like that 14, maybe that 20-day period. Because after that, that's when the viruses and stuff starts to go down after a certain period of time. So they're more contagious when you can't tell that they're sick. And that's why we quarantine people during that time, right? That's when we're telling people not to go out in the beginning. But when we told everybody to wear masks, it became different. But that's why we were quarantining people for that first 14 days, because that's when people had the highest risk of spreading it. And you didn't know. And that's when they are asymptomatic, when they don't have very many symptoms. That first 14 days, unfortunately.
I have a question. So, being that you're working in the medical community, what are your thoughts about the guidelines when wearing masks was lifted? Do you think that was too soon? Because I thought it was kind of reckless, even if you're vaccinated.
Yeah, I think that was probably the consensus among a lot of people within the medical field. And it's funny, because if you would see a lot of the docs and stuff like that, I don't think any of us ever took off our masks. And it's funny because it was kind of like, if you're vaccinated, you don't have to wear a mask, but if you're not vaccinated, you have to wear a mask. And I guarantee you that a lot of the people that you saw wear a mask were people who had vaccines. Yeah, because I think a lot of us felt like you were saying it was too soon, and now you're saying they're backtracking. Now they're saying put the mask back on, and I don't know how easy it's going to get. I don't know how easy it's going to be to tell people to put the mask back on when you told them it was okay to take it off, right? But yeah, I think it was too soon. But that's just my personal opinion. I'm not CDC, but I think it was too soon, and obviously it's too soon because now CDC is saying put the mask back on when you go indoors.
There's a question about for a vaccinated person, if they contract COVID, they're asking about should they quarantine for another 14 days? What's the
So they're not doing the quarantining anymore. The quarantining thing, I mean, they're of course they don't want you to, you know, be around folks and things like that, but the big thing now is the mask. The big thing now is having folks wear masks. The quarantining was in the beginning, and of course if you know you got COVID and stuff like that, you shouldn't be around folks and you should be quarantining, but I don't know if that's an official recommendation anymore. The big thing now is like, get treated. I will say this though, which is awesome. If you find that you test positive for COVID, and this is something that people may not know, if you test positive for COVID within the first 10 days, you can actually get treated. Like, you don't have to just do Tylenol anymore. If you go in and it's within the first 10 days and you're expressing symptoms and you're not sick enough to be admitted to the hospital, right? Like, so you're not on oxygen, you don't have to be admitted. We can do monoclonal antibodies now. We can do so many different treatments. Like, we can give you medicine that can actually make you better. Like, I've seen people get better within 24 to 48 hours with a 4-hour infusion because now we have therapy. We have treatments. And I know a lot of people don't know because we haven't had people come in to get treated. And people are testing positive and they think, still, like, I just stay home and I just take Tylenol and I, just make myself better. And I tell people, no, we can treat you now. Like, we figured this stuff out. We got better. It's been a year, but we got better. We know what we can do now. So I don't know if they're doing that quarantine thing. I don't know if that's an official recommendation anymore because we do have therapies now. We have treatment. We're like, come get antibodies, come get medications and things of that nature. Wear your mask. It's so many different things that we can do now. So yeah, I don't know if they're not really doing that 14-day quarantine.
Yeah.
How concerned are you about the kids going back to school and the ones who are unvaccinated?
How concerned are you about kids going back to school, particularly the age group that are unvaccinated?
Very concerned. Very concerned. Like, I think it's a double-edged sword. I think, the kids have been out of school for a year and a half, and so mentally I know that they're all ready to go back, but I am concerned. I have 2 little ones, and both of them under the age of 12, so neither one of them have the vaccine. So, and I did not send my kids back to school at all. So I know they did the hybrid thing, and I completely kept them remote because of the vaccine. And so even now, it's kind of like I don't know what we're going to do because we don't know what this Delta thing is going to do. So it's a concern about whether or not it's safe to go back with them not having a vaccine. However, I do think that Pfizer is right on the cusp of coming out with a vaccine for the kids by the fall. So I do think that the vaccine will be ready by the fall. And I do notice that kids do not get as sick with it as the adults have. However, I don't know how the Delta is affecting the kids. I do know that the kids get a little bit sicker with the Delta, but I don't know, the data just yet. So I am concerned. I'm hoping that the vaccines come out in the fall like they're saying it will. If not, I don't know how that's going to play out.
Oh, one more thing.
Yeah, it is about the same. In her opinion, the school should require the vaccine. In her opinion, the school should require the vaccine.
The question is, in your opinion, should schools require vaccines for those that are, I guess, 12 and older, because that's the only one approved? And then my other thought to that is, what do you think, should schools also mandate masks?
I know Chicago public schools are mandating masks. That is a mandate already. That has come out. That is a mandate for Chicago public schools, that they have to mandate those masks. I know that as far as the vaccines, I think that's going to be because it's emergency use authorization. I don't know if they can authorize that, mandate it just yet. So I think it's going to fall onto the parents to do. I know that they're going to strongly encourage it. I know that they're hosting events at the schools to get those kids 12 and over vaccinated. And I think it's going to, but I think that they're still pushing it on the parents to make that decision. I would push for my kids to get it as soon as it comes out. But I don't know if they can make it a mandate just yet until it's, authorized. I do know that they are being very, very, very cautious with the vaccine because it's the kids. So they want to make sure that there's not going to be any side effects. And I think that's really tough to try to require the children to get it and not knowing the long-term effects of it just yet. So to try to make them mandate it while it's still under emergency use is going to be kind of tough.
Well, Dr. Gordon, we certainly want to thank you on behalf of the Greater Whitestone Ministry. We want to thank you for taking this time. You were fabulous. I thought I knew a little bit of something, but you have enlightened my eyes. So we certainly want to thank you for taking this time to help us out. We're located on the west side of Chicago, the area, and so this information is definitely needed. And we so appreciate you taking the time this afternoon to share your insight and wisdom. So.
No problem, no problem.
Thank you again for everything.
All right, be blessed. All right.
Y'all take care. Bye.
I worked with her, and a lot of what was saying had caretakers that were bringing their vaccines in. She taught them all. She was like,